Alright, you guys are live.
All right, good evening.
All right.
Hello, everyone. Welcome.
Welcome, everybody. We're doing a live today. I'm here at Rejuvenation Clinic with Nurse Yalda.
And Dr. Retana here.
This looks pretty cool right here.
Yeah, we put so much effort into this. We tried to make it as cool as possible. Hopefully, this is going to be a fun 45 minutes to an hour for everybody. For me, for Dr. Retana, and for you guys. Hopefully, we're able to answer some questions, share our knowledge.
Yeah. And in the meantime, as you guys are logging in, let us know where you're logging in from. If you're logging in from out of state, from DC, Virginia, Maryland, and if you're logging from those areas, we would like to know, like, are you guys from Frederick, Maryland, Fairfax, Virginia? Like, where are you guys from?
So where are you from?
I'm from Germantown, Maryland.
Germantown, Maryland. Gotcha.
How about you? Where you grew up?
So grew up?
Yeah, like here in the
So
DMV.
I do live in Oakton, Virginia, and I do practice in Arlington. I think our office is pretty close to each other, correct?
Yeah. I'm on M Street and 23rd, West End, Foggy Bottom.
So I had the pleasure to meet Dr. Retana on Instagram. I was checking out his work. I think he's extremely talented. I love his personality, love his energy, and it's just amazing to meet providers that they're so kind, humble, and absolutely skilled. Number one, I'm honored to have him here with us at Rejuvenation Clinic.
Amazing. And I'm honored that you, I think you found me on Instagram and then we started interacting back and forth on DMs and things like that.
Liking pictures, how important it is.
And now we're doing this collaboration. So this is amazing.
All right, so how many people do we have live so far? 29. All right, guys, thank you for being here. So, we're going to start with 3 topics, or we're going to talk about 3 topics.
Yeah, so tonight we're going to try to keep it as brief as we can. We'd love to hear you guys, discussions on our questions. But we're going to talk 3 main things. One is surgical versus non-surgical BBL. Right?
Exactly. And that's for Brazilian butt
lifts.
For the ones who don't know.
Exactly. Brazilian butt lift or fat transfer to the booty or injections to the booty if you don't have any fat, right?
For enhancement.
Correct. And then the other thing that we're going to talk about is facial contouring, surgical versus non-surgical facial contouring. So cheekbone enhancements,
jawline, reduction of the buccal fat. Yeah, because that's the thing. Everybody want to look chiseled, like a V shape, high cheekbones, and more like a defined jawline.
Correct.
And then number 3.
And number 3, we're going to talk about, for those of you guys who are nurses out there, doctors, future injectors and future surgeons or future doctors in aesthetics, how we got into our fields. We have pretty, we have a story. They're actually pretty long. The other day we sat down and talked about how we got into our field. It is pretty long, so we'll give you like a short version of how we got into the field. And obviously, if you guys have any questions, you can always DM us. We're pretty accessible on Instagram. So if you guys want
to share and help.
Yeah, if you guys want to go into this field that is definitely booming, give us a DM and we'll guide you guys. We'll love to help for sure.
Dr. Retana for sure love to teach. So do I. There's so many things that I still would love to learn from him. His techniques are amazing. How he does his tear trough. There's so much. Yeah, the fillers. Yeah. So I'm excited to learn from the boss here. So.
And I'm excited because she's been taking all this technique courses with world-renowned nurse injectors, and I love to pick your brain on how you're getting those lips so amazingly looking these days.
Well, thank you.
Yeah.
All right. So, how many people we have live? So we can start maybe.
In total, we're about to be hitting 60.
All right, amazing. Could you guys just do me a favor and get me live on my iPad so I can read the question that way?
And while they do that, you guys send us on messages where you guys are logging in from. If you guys are logging in from New York, Miami, Texas, Virginia,
Iran, Turkey,
Costa Rica.
Costa Rica. Costa Rican, okay.
And I know I have Costa Rican followers. So if you guys are from Costa Rica, let us know. We'd love to hear you. One thing we haven't told you yet is we're going to be doing giveaways, right? We're going to be giving one. The first one would be what?
1 syringe of Voluma. So we're going to have 3 winners. One my patient, and then also Dr.
So
Retana's
we're gonna have
patient.
six winners.
Yeah.
3 on this side and 3 on your
My
side.
side. So one syringe of Voluma.
1 syringe of Voluma, right? 1 syringe of a lip filler.
And the third one.
And the third one is 20 units of Botox. So if you guys participate tonight and engage with us tonight, we have 2 lovely ladies that work here at our Rejuvenation Clinic keeping a tally of all your comments. And those of you who comment the most will get into that tally and will win those 3 prizes on my life and on her life. So
I think that's pretty exciting.
I mean,
Or also number 4 could be Dr. Retana. He's an amazing dancer, so he could maybe teach us some moves. Yeah,
and we could also maybe see some
dance class.
Maybe we could see some belly dancing from from
Iran.
You do belly dancing in Iran?
Just a little bit sometimes. Depends. All right, guys.
All right, good stuff. So why don't we get started with the night, and we start with the first topic, which is surgical versus non-surgical BBLs, or Brazilian butt lift. If you guys have any questions about that, please go ahead and ask us questions about surgical versus non-surgical.
That's the topic,
BBLs.
man. That's the topic. I feel like everybody wants to have a little bit of a volume down there.
100%.
And I think a lot of my patients, they come to me, they look amazing, they do go to the gym all the time, they work out a lot, but they just need a little extra help. So what I do in my practice, for as far as the non-surgical, would be either hyperdiluted radius or Sculptra. Both of them are just a biostimulator, meaning it's just going to help your own body to produce some collagen. A lot of my patients, even after a second session, they get such an amazing result. Not necessarily all the patient wants volume. Some patients perhaps need a little bit adjustment because one side is smaller than the other side, or they have a hip, so I can get rid of that with my treatment. However, when it comes to the surgery...
Yeah. So you just thought a little bit of what you were saying about that, like, you know, both of those products, Sculptra and hyperdiluted radius, amazing products for those patients who don't have the fat to take from other areas to inject in the booty, right? And let me ask you this question, like how long does it take to do the procedure?
So when it comes to the non-surgical, when my patient comes after going through consent form, pictures, honestly the treatment takes about 20 minutes. After you're done with your treatments, you can resume your normal activity. Of course, you'll be a little bit sore. The goal is to never bruise the patient, but there's always a possibility for a little soreness, bruise. However, you can sit on your butt, which I know when it comes to surgery, that's a little restriction right there.
Yep, for sure.
Usually a patient comes back to me after 8 to 9 weeks. We do the second session, and pretty much everyone's happy. They see a huge improvement, and a lot of patients ask me after how long should I do the treatment again. But I think as we all age, we lose collagen, so obviously again your butt can sag again. So my recommendation would be after 2 or 3 years you can come back, do another session, and just kind of keep it as a maintenance.
I love it. So we're getting some questions here. Cookie Cutter says, hi Cookie Cutter. If you lose some of your BBL volume, can you do a non-surgical BBL? Absolutely, yes. You can definitely do non-surgical BBL after you, if you lose some volume after BBL. You can also, you always do a round 2 BBL, right? That's an option if you still have fat in certain areas, like, other areas like your arms or your legs and places like that. But if not, I actually do recommend, some patients do end up, if they have little indentations in the skin, right, like little cellulite things,
They can do.
before the BBL, they're most likely, it's going to improve with the BBL, but it's most likely going to kind of stay there. So a non-surgical BBL treatment with hyperdiluted radius or Sculptra would definitely help for that, or to just stimulate collagen formation in the booty for long periods of time. Yep. So that's a great question, Quick Cutter. Love that. I have another question here, unless you have one over there. I have one here from Jenny Coombs 703. Thank you for asking this question, Jenny. How about hip dips? Which would you recommend? Hip dips. So
Hip dips.
It would depend, right? It would depend on whether you have, enough fat for me to harvest through liposuction, and then put that fat in the hip dips. If you don't have, you're super athletic, super fit, you have zero fat content.
Then will be the non-surgical, which will has to be the, again, hyperdilated radius or Sculptra.
What's your preference? Like, what do you like better?
I really think both are amazing. I think it just depends on which brand you like to use. As far as the pricing, they're a little bit different, but I use them both. My patient loves them both. Some patients are more familiar with Sculptra, is more common, but we use both in our practice, and I love them both.
You like them both?
Yeah.
Yeah.
So, what else? What's the next question?
We have more questions coming in.
You guys can also help with reading the question, huh?
Does the BBL help cellulite, or is that separate?
What is the question?
Does the BBL help cellulite, or is that separate?
Okay, so the question is, does the BBL help with cellulite? And the answer is, cellulite is a skin problem. BBL is a change in volume at the fat layer, right? So it helps a little bit, but don't expect your cellulite to completely go away with the BBL.
Exactly.
We're still, do you guys do cellulite treatment here?
So, believe it or not, with the hyperdilated radius or Sculptra, it does help with the texture of the skin as well. But at the same time, if your body produces cellulite, it will come back. So it's just something that you have to maintain with different treatments to manage it.
Yeah.
It's more like a management than trying to get rid of or stopping the body from producing it.
That's correct. There's still no cure, quote unquote, for cellulite, but there are treatments. Kind of like, there's no cure for diabetes, but we have medicines and we have treatments for diabetes, right? Same thing with cellulite. We don't have the cure yet. But we do have plenty of treatments, and the BBL is one that can improve things. The non-surgical options are another thing. There's machines that can improve things as well. So these are all amazing questions. Love it.
And as far as the pricing, one thing I always tell my patient, I think Dr. Retana can relate to that it really depends. Everyone's different. I think I always recommend consultation. It's better to come to the office to do a consultations. Not everyone necessarily also a candidate for hyperdiluted radius. So it's so important to come in to see what your expectation is, and based on that, we can provide you guys with the pricing. Pricing can range between $2,000 up to $6,000. Again, it depends on the patient expectation and your body and your anatomy. Maybe it's a little bit different for you guys, but as far as the price, that they're asking about the pricing.
Pricing, yeah. I mean, I think pricing. I always sort of give the same answer because it really depends. It's like me asking. I always say this. Like, it's me asking. Like, let's say you guys do remodeling of a kitchen, right? And I tell you, hey, can you how much would you charge me to remodel my kitchen? And you would say, how big is your kitchen? Right? Your kitchen is like a small kitchen or like a huge kitchen, right? So it's like, it depends. So do you need a small little fix, right, with non-surgical, or do you need a big kitchen, a bigger kitchen, right?
If you want a bigger kitchen, you go to Dr. Retana.
Exactly.
Small kitchen.
Exactly. And then even with the non-surgical, you may need one treatment to get to your goal, or you may need 5 treatments to get to your goal.
And
right?
I think it depends on patient's expectation.
Yeah.
Maybe something that may looks great on one patient, it looks extremely not natural on the other patient. So it's great to come have consultation, and we can provide you guys with that kind of a pricing.
We got more questions from Sylvia and also from...
Thank you. You guys are the best for watching this, and thank you for joining us. Honestly, we're honored to be here.
So many people logging in. So, I mean, I'll just say this. So, keep asking questions. We may or may not get to your question because we have a lot to cover. But keep asking the questions, because the more questions you ask, the more chances you get to win one of the giveaways, right?
Oh,
so continue to ask questions.
Hey, girls, boys, that you can get that Voluma.
Yeah, get that Voluma, get the lip fillers, or get some Botox.
Are you interested for some lip filler?
Yeah, I'll do some lip fillers.
Yeah. Maybe he'll be the winner, and I'll do his. Are you into Russian lip technique, by the way?
I can't comment too much about it because I guess the technique is out there, and it's... Do you do it?
I don't know much. I'm not that knowledgeable when it comes to Russian techniques.
Yeah.
However, I always tell my patient, my goal is to enhance my patient's beauty. I don't necessarily love the word is not fake, but I don't like dramatic looks. So perhaps I would not go for the Russian lip technique because again, it depends on the area. We're in a conservative area. We live in DC. Perhaps if I was practicing in LA or Florida, I would do the Russian lip technique. Yeah. But my kind of work, I like to enhance my patient's beauty, not necessarily changing the look.
Yeah, and that's exactly it. Like a lot of times, whether it is lips or whether it is a Brazilian butt lift or liposuction, a lot of times, I do get people that they want like a mega booty, right? Like they want a mega Brazilian butt lift, and that's just not me. It's not my reputation, if you will, right? Like my reputation is I can build a good projection on somebody. If somebody's flat, I'm known for giving projection. I'm known for giving hips, but I'm also known for the natural results because I think natural results really like last a long time and really like go a long way. And when you have like a mega booty, it's kind of like I tell the patient, like, listen, we have a couple of things at stake. Is your body, is my reputation. Mm-hmm. So we both have something at stake. So, sometimes those cases go like to Dominican Republic or Miami or somewhere else because I just don't do them like that.
And honestly, I think 6 months ago when I started following Dr. Retana, going through his before after pictures, one thing that was very impressed that I think your work is extremely clean but very natural, and I love that because I'm just not a big fan when it comes to patients looking fake because I think that's just not something healthy long term. For future, when the patient is 50, 60, when they have back pain and all this other condition, you might want to think ahead. And I respect surgeon like Dr. Retana that consider other things besides the look at that moment.
Yeah, exactly. And same thing goes for lips. Like I've seen your endless posts on lips and facial enhancement, facial balancing posts that you do, and it's all about balancing somebody's face so that it just looks natural and balanced. Not necessarily. What do you think about symmetry? Like, do you ever chase symmetry, or do you chase more like balance?
I think more balance. I don't believe in making people symmetrical because I don't think that even exists.
Exactly.
I think there was a study that they chose a supermodel and they tried to make her make everything symmetrical, and because no one looks at you from this angle, everybody looks at you from a 3D angle. Actually it gives you more character. You don't want to be like symmetrical, so I'm not really after that. I'm after making it more balanced but not symmetrical. All right, some good talk about lip injection. So what's next? What is the plan?
A lot of people want to know what the difference between Russian technique and like other lip fillers.
Lip fillers?
I mean, yeah, like lip fillers.
So again, I think with the Russian technique, it's just more dramatic. I think it decreases the distance between your lips and your nose. That's all I know about Russian techniques.
Yeah, and then the other techniques would be like there's many techniques for many lips. Like not every lip is created equal, and not every lip is injected equally either. There's like the M-shaped lips and like the very super thin lips and like that. I mean, those are the things that we look at as injectors, looking at like age factor, the skin, like how not how thin your lip is, but also how thin the skin of your lip is. Like your personality, your face as a
what
whole.
you do for a living,
That's
right?
true too. Yeah.
That's so important. I mean, I think we live in a DC area that not necessarily people want to look certain way. And again, if we are living in California, LA, I'm sure that's more like accepted in that area. What other questions?
We have a question from Dr. Retana's live from Miss Sylvia, quadruple A. How does lip filler migrate? Is it common? Do you see this often with new patients?
Yeah, so lip filler can migrate. Even, great injectors like Yalda and I, we see lip migration here and there. And it's all about the technique on how to prevent the filler migration. but it's also, you know, how to deal with it when it does, because it can. Even like, you know, world-renowned lip injectors like Julie Horn, and they everybody gets it, right? But yeah, we're injected into a very dynamic area like your lip that you used to talk every day, eat every day,
chew. Talk, chew,
every,
move, talk, especially women.
Like, yeah. Like
we talk so much, so things can move around a little bit.
What's your take on lip migration?
No, I really think it also depends on the technique. I was taught that it's so important that it depends on the patient anatomy. If someone has a very small lips, you don't want to inject too much in one session. You really want to be mindful of that patient may come to you and ask you for a certain look, but you have to make sure if that's the right look for that patient. Injecting too much filler in one session, I think that can increase the chance of filler migration. But again, as great as you, as great as Julie Horn, the lip filler migration can happen. And I believe like no one is perfect. Everybody can make a little mistake, but I think it's also a matter of how to manage the complication or how to fix the issue, which is very simple.
Exactly, that's the thing. That's one of the easy things that we can do. It is all we got to do is just inject a little dissolver into the spot with the filler migrated, and just get rid of it. And yeah, sometimes even when you do it perfectly, the filler may migrate a little bit.
Someone asked, how often can you get fillers? I think it really depends on the area. 2, it depends on the patient's age. And 3, also it depends on the patient expectation. If we're talking about lips, I believe it shouldn't be more than once a year, but it depends on the patient metabolism, age.
In terms of how long it would last?
No, they're asking like how often they have to get it done.
Yeah.
Depends on expectation and age.
Age, how fast they metabolize the filler, what area we were talking about, lips versus cheeks versus, tear trough areas, chin, jawline. It all depends. They all have the FDA approval, right? Like, let's talk about some of the stuff that we're giving away. So, Voluma. Voluma is FDA approved for up to 2 years, right? Keyword, up to 2 years.
To 2 years.
So it may last on someone less than 2 years, like 8 months, 9 months, 12 months, 18 months. I can tell you that some of my patients have actually lasted longer than 2 years, like 2.5, 3 years. I'm like, oh wow, that's a very long-lasting filler. Some of the lips that we use for some of the fillers that we use for the lips may last. They're FDA approved for 12 months.
Exactly, right.
But that doesn't mean it's going to last you a whole year. It may last you 6 months, 9 months. And the other thing is, like, you may want to even come back for a little touch-up before it's all gone, right? So you sort of get the first syringe done, and you come back 6 months later, 6 months later, get another little touch-up, and you just got to maintain that look.
Yeah, you don't want to wait till everything is back to day one. So I think you can come back 10 months whenever you think you need it. I think someone asked about fox eyes. What are your thoughts on the fox eye, Dr. Retana?
On the fox eyes. So the
Bella
surgery.
Hadid.
Yeah.
Let's talk about that.
I don't know. That's like a trendy thing right now that people are talking about, but I don't know. I don't really have a comment about it because I don't really do them, and know anybody, like none of my friends in the surgery scene does them, so I don't really have too much to comment about it. I think, like if it fits your face and it's something that you want to get it into, definitely educate yourself in terms of the benefits of it and also the risks for the kind of procedure.
Yeah, and someone just asked, what is the fox eye? Usually it's a new thing, mostly like Bella Hadid look, that the eye looks like a little cat. So we do it sometimes non-surgical using PDO thread lift, but I really tell my patient it's just something that it doesn't last long. It lasts between 6 to 8 months. And if someone needs a blepharoplasty, that's very different. That's something surgically needs to be done. But if for someone who wants to have a lifted like brow, this treatment is nice. It looks great for a couple months, but then after that, you just have to repeat the treatment. So I do offer it to my patient for ones that they really want it, but I'm not very crazy about it.
Yeah. I guess my question would be the PDO threads that you use. What's their FDA approval like to last? Up to how many? Do you
I
know?
think PDO thread, it also depends on the area and how many threads we're using. Usually patients' resolve will last between 11 to 12 months. Again, it depends on the patient's skin condition. It depends how much they're taking care of their skin. Again, if they're not the right candidate for the left, I prefer referring them to a surgeon.
Got it. And I think PDO threads are great, and you do them really well because I've seen your post on PDO threads and what you can do with them. What is one of your favorite areas that you're like, oh, this is the one area that I really like to use PDO?
I think the lower face, because a lot of patients can get a beautiful lift just using some filler through the upper face.
In the mid face?
Yeah, mid face, upper face. However, when it comes to the lower face is where the struggle is. A lot of my patients, I'm sure you get that too, that they don't like how their jaw looks when they're looking down. And not necessarily that is fat, that is just like little saggy skin. So when I do my PDO thread lift for the jawline, it gives them a very nice, beautiful lift. PDO thread lift, it also helps with stimulating the collagen. It is non-surgical. And the beauty of it is when you come to the clinic, the treatment it takes about 45 minutes. After that, you can resume with your normal activity. You know, it's no restriction, and patient loves the results. But if you are extremely saggy, if you're heavy, if you need liposuction, if you need buccal fat removal, that's why I'm trying to be very as honest as possible and refer my patient to surgeons. And tell us about your buccal fat. I see you doing some, magic down there. So
yeah, I mean, everything we're talking about today, lip fillers, we talked about Voluma, which is great for cheek contouring and jawline contouring, buccal fat part reduction. If you guys follow my Instagram, you see that I do a ton of them. I love that procedure. Is one of my favorite procedures to do. It's super easy, quick, minimal downtime. It's done scarless pretty much because it's through the mouth, and it's done under local anesthesia. So it's like what every cosmetic patient is looking for. Like no downtime, good enhancement, gives me a rejuvenated look and a more slender, slim face. What else? I don't have to go to sleep for it, right? No general anesthesia, sure. Does it hurt? Not really. So it's like it checks all the boxes of like the best thing, and it is. Not every surgeon is sort of trained in it, and I love the procedure, and I've done a ton of them, and I can tell you that definitely look through the before and afters in my Instagram for buccal fat bar reduction, and it's just taking out this area right here of the cheek, just a little bit of fat from there. You would know what this does just by knowing all the ladies that are listening to me right now. If you ever, before you get ready to go to dinner and you're about to do your makeup, one of the first things you do is you draw a line from your ear down to your mouth, right? That's that contouring line to make sure that you enhance your cheekbone and you create that little depression of your cheek itself. That's what the buccal fat pad does for you. Instead of you doing that makeup line every day, you already have that natural contour there from the time you wake up to the time you go to sleep. Yeah. So that's the beauty of that.
I know.
procedure.
I have seen the results. It's amazing.
Yeah,
I love them. And I think for a lot of patients that they try to lose weight, they can't get rid of that stubborn fat. So I think it's a really easy procedure to permanently.
Yeah.
It's permanent, right?
It's permanent, yeah.
Awesome.
That buccal fat pad never returns. And one of the things, one of the taboos that people talk about a buccal fat pad is like, oh, but we, in the aesthetic world, we're taught to fill,
Mm-hmm.
add volume, add volume, add volume. I can tell you that never has Yalda or myself added filler to this area right here.
We do not want to look, no.
We want, the two areas we enhance is the cheekbone and the jawline.
Mm-hmm.
And this right here, we want to keep a nice indentation so that you get that chisel look, that slender look, instead of that round face, you get that sort of oval type face that makes you look more skinny. I can tell you that everybody I do that procedure on, they come back and say, oh, my friends are asking me if I lost weight, which I love. I love that they're asking me if I'm losing weight, but I don't think I've lost weight. I just got the procedure.
Is that why when girls want to look sexy in camera, they go like that? So
there you go.
That is what Dr.
True,
Retana
they do
permanently.
you perk your lips up and you do one of those things. You're right.
Absolutely.
Yeah.
All right. So what other questions?
Someone just asked, is there a risk of sagging in the future after the buccal fat removal?
Yeah. So no, there's no risk of sagging from the buccal fat bar reduction. That is, it might be in the internet somewhere if you read it on Real Self, you read it on like Facebook blogs and things like that, but it's scientifically, no, there's no evidence of that the buccal fat bar reduction would induce more sagging of the skin later on in life. Absolutely not. Yeah. Like I said, it's a great procedure. I wanted to comment on something else.
I'm going to pick up the mic a little bit towards you.
This one?
That one. Yalda's mic.
Yeah, this mic towards you?
Yeah, just to pick it up just right there.
There you go.
Perfect.
And then I'll do it like that. Someone was saying they couldn't hear you a little bit.
Okay, thank you.
I have a great question for you, Yalda. That one, MN2XDY, Mindy asks. She says, is there a way to get lip fillers without that duck lip look?
Of course, yeah. I think when you inject so much filler into the lips in a very short period of time, it creates that duck look. So I think you just have to respect the anatomy, and you just have to make sure you're not over injecting. I do love lip injection. It's such an art, actually.
Yeah.
So if you guys go check my page, my before after, none of my patient looks like a duck. They don't have a duck looking lips.
Yep.
And I think it creates that duck lip when also the filler migrates.
Yes.
To the
100%.
Yeah,
So it has to do with injecting in the right place, injecting the right amount. And one of the things that, we both idolize Julie Horn, because she's such a great nurse injector. One of the things she talks about is being able to inject the lip without protrusion of the lip, right? Don't protrude the lip. Just add the volume, give the hydration, give the definition of the roll, but don't protrude him like a duck. And that's exactly the technique that we both really use.
And I think that used to be such an old school. I don't know if they. I thank God we don't see it as much.
Yeah.
And I think it also depends on the filler that the provider choose.
Yeah. And that's the thing. The other thing is that, now with Instagram, you see all kinds of craziness that people post. But I think you should go to let's talk about in general. Like if we talk about lips, we talk about BBLs or liposculpture, whatever it is. Go to the provider, the surgeon or the injector that provides the results that you like on a consistent basis, right? Don't go to the injector that every time they inject, their patients look like a duck, right? Like don't go to that one because obviously they have a technique that they can reproduce every single time that looks like a duck, right? But if you go to an injector that every single time injects lips and they look absolutely gorgeous, they want you to go to that one, right? If you see a surgeon's page and you see that you like the abdomens he does, the BBLs they do, the facial contouring they do, and they do it consistently, day in and day out. Day in and day out is the same beautiful procedure, and you keep liking that page. Hello, do a consultation with that surgeon, whether that surgeon is in Texas, Miami, Florida, wherever here in the DMV. Go to that person because that's the guy or the girl for you.
So I have a question for you. I get a lot of patients that they're willing to travel to the different part of the state or different part of the country because they believe that cosmetic surgery necessarily in this area is very pricey. So what are your thoughts on that as far as, okay, well, the patient will save $4,000, the patient will save $5,000. Why not to save the money?
Well, so many things, right, to say about that. I mean, I think for the longest time there's been that reputation in the DMV that the surgeons in the DMV are a little too pricey. The surgeons in the DMV are not producing the results that we see in Miami or we see in Colombia or we see in the DR. Well, that's no longer the case. Like I feel like we have enough talent, or at least myself, I follow the South American techniques of liposculpture and fat grafting. So, I brought that to the area and I will continue to bring more techniques to the area for that. In terms of pricing, when you look at clinics in Miami, the reason why those prices are so low is because they're doing 8 or 9 or 10 surgeries a day. I can tell you that no one surgeon can do 8 or 9 surgeries a day and maintain the quality they did in the first 2 cases of the morning. As the day goes on, you get tired. And the other thing is not one surgeon is doing that procedure. You're getting a ton of ghost surgeons, people you never know, are doing your surgery. They're doing your surgery. because that's how those clinics operate. So if you're finding the cheapest price, it's because there's a reason why it's cheap. Because they're not there for quality, they're there for quantity of people. And if you talk to people that go to clinics in other countries or in Miami even, you will find out how they were treated and how crazy the clinic looks. I can tell you that this beautiful rejuvenation clinic is probably a really smooth, nice spa feeling kind of place. We run our office the same way, very boutique. We like to provide quality, and we like to take care of the volume, but we like to keep our quality
No,
versus
that makes
everything
sense.
else.
I do see a lot of patients that I hear their story that they travel to somewhere outside U.S. and they came back with tons of complications. So the question is, do you see patients that they have complication after their BBL that was done with a different surgeon in, I don't know, Colombia, in some other countries?
I mean, I can tell you this. Obviously, there's a ton of talent in Colombia because I actually go myself to Colombia to operate with some of my buddies down there, and that's how I bring back techniques from Colombia and techniques and instruments and different things, right? So a ton of talent, a ton of great stories of people that travel, but also a lot of disasters, right? Because some people end up at the wrong place with the wrong person with the wrong clinic, and I actually do. I see a lot of that stuff. People call my office, and I speak Spanish, so some of the ladies that do travel are Latinas who are looking for a surgeon that speaks their language in Latin America, and then they come back to the DMV, then they start looking. Most surgeons in the DMV will say, no, you went somewhere else, we're not seeing you, right? I do see a lot of them, and I do see a lot of complications, and I can tell you that in my training, I was taught or trained to handle all these complications. So why not help these people that are in need? My philosophy about that is like, you know what, I'm going to go ahead and extend a hand, help them out in the time of need, because I know that patient, I don't think they're going to travel again. And I know if their sister's going to get surgery next year, they're probably going to talk them out of traveling and maybe staying in the DMV with people that know how to do that surgery, know how to handle complications if something were to happen.
And I love that about Dr. Retana, because I know a lot of surgeons that they don't take the responsibility. You traveling to Colombia or other part of the world to save some money, coming back with infection, with complication, it's a liability for the provider, for the surgeon. And I have so much respect for this young man here, younger than me, that he will take that responsibility, that is willing to help his patients. So, all right, guys. So what are the other questions?
A lot of people want to know about your guys' backgrounds
Okay.
and like why you chose the field that you guys are in now.
Okay.
Who wants to go first? You want to go
I can go first. Yeah.
We let Dr. Retana go first.
I'll go unless you want to go first. Ladies first. Unless you want me to go first, I don't mind.
Age?
Age. Okay. Fine.
Go for it.
I'll go first. And because we've been doing this live for a little bit. We don't want you guys to get carried away. But anyway, so I got into this field. I mean, I always knew I wanted to be a doctor, and always loved sciences, math, all that stuff. And I came to this country when I was pretty young, 14 years old, and did high school, college, everything else. I can tell you a quick story that during my college years, because of my family immigration status, I actually got kicked out of college. And it was a tough situation for me to deal with because I knew what I wanted to be, but I couldn't continue my education because of the immigration status. But I can tell you guys that really, really motivated me to continue to try, continue to stay in school, and I was able to continue. And long story short, I did several training. I did head and neck reconstructive work as a maxillofacial surgeon, and then I continued to do general surgery. Then I continued to do a fellowship in full body cosmetic surgery. So I trained in multiple things, and I can tell you guys that the one thing I love is doing surgery. Like,
that's your happy moment.
That's my happy place.
My
happy place is to do surgery. I even on the weekends volunteer my time, not every weekend, at the hospital and do facial trauma reconstructive work. But every single day of the week I do cosmetic surgery or surgery period. So it's been a fun field. It's been a fun ride in so many different directions, and I'm here now in DC. I love the DC area. I couldn't be in a better place, and just doing collaborations with you is it's an amazing thing.
What a blessing.
Yeah.
All right, so about me, I moved here to US when I was 18, and that's almost 19 years ago. When I moved here, I really didn't know what I want to study. I tried different majors. It didn't work out. The main reason was English is my second language, so I couldn't even speak the language, so that was a struggle right there. So I left college. Just did some work at the restaurant. I was a bartender. And back in 2008, I decided to go to become an esthetician because I grew up with a severe cystic acne. Face was always awful, and I didn't like the way I look. And I think I mentioned that once before in my life. So I never liked my look. I had cystic acne and very, very unhappy with my look. So I did the esthetician for a couple years. I was very lucky, and I got hired by a facial cosmetic surgeon, Dr. Dario Hamra, who he's still my mentor. He trained me in the operating room. I became a surgical assistant, and then I got motivated to go to school and be a nurse. I did some couple years at emergency department, cardiac unit, but meanwhile I continue with working with Dr. Hamra, assist him during facelift, rhinoplasty, buccal fat removal, his number one. It's my favorite surgery, honestly. So I just love cosmetic procedure. I think a lot of women, we have this insecurity, unfortunately. Not much guys. I hear this all the time. I have really beautiful girls coming to my office, and they just have this little problem about their face, whether it's the lips, whether it's their acne scar. And by just doing a little bit of a tweak, you can enhance their beauty. And I think you can really help them tremendously. So I do love to help people. I'm a nurse. I love to help. I care a lot. But I really love to help women to have that confidence because it's just a women thing.
Yeah.
Believe it or not.
That's amazing.
Yeah.
So you started being a nurse in the hospital, right?
I started emergency room at I know a Mount Vernon. I did that for a while. I became a cardiac nurse, and 2.5 years ago, I decided to focus on some injectables and cosmetics. So I was doing both together. Meanwhile, I was working with a plastic surgeon, Dr. Hawke in Maryland, and Dr. Hamra, who still is my mentor.
Yeah.
I got a new mentor as well. He's been amazing, so I got to thank you for that.
Yeah, no,
I got one complication, not a complication, just a patient who had an allergy to lip filler. First person that I text, Dr. Retana, help.
And you're able to manage it really well, and everything's fine. And we can tell you guys, don't get scared. Lip filler allergies are super rare, super rare. And it's just you have to go to a provider that can handle the complication, right, and can sort of walk you along the side effect, and that's it. There's a lot of questions here. One of them is for you, Yalda.
Someone's asking where did you go to school?
I went to school at Columbia. You ready? Here we go. I went to St. Mary's College. I then went to Thomas More College in Kentucky. That was my undergrad. Then I went to Columbia University and then University of Florida. That's where I completed my medical school. I then did, still at University of Florida for my head and neck training. Then I went to general surgery, same thing at University of Florida. And then I went to Oklahoma for my cosmetic surgery fellowship. So I've been all
one
around.
of the best. I have respect for you, man. That's
It is top-notch program.
Trust me.
I was blessed to train at UF with some top surgeons. I was blessed to train in Oklahoma with also top surgeons, and that's why I feel very confident in doing every single procedure that I do. I feel confident doing because of the training that I have from those guys. So, and I'm sure you too. You've had great mentors with Dr. Hamra,
Dr. Hamra, absolutely,
and everybody else that has trained you has made you
a better
Nurse Yalda, which is your brand, which is who you are today, and you're able to offer the services that you do at a high level because of all those people sort of shaping you into who you are. That's the way I feel. I mean, sometimes I'm doing a procedure and I actually hear
You
my
hear that?
mentor saying, like, hey, make sure you do this to avoid A, B, and C, right?
That is
Isn't
true.
that how it works?
No, you can hear their voice, that
That's
little
right.
voice talking to you.
That is correct.
Oh,
Someone's
what
asking me
honor.
what my favorite procedure is. Lipo 360 BBL. That is my liposculpture of the abdomen with a Brazilian butt lift.
Your work is an
if
art.
if I can do that procedure every single day of the week, but I won't do it. I'll tell you why. For the rest of my life, I would. But I won't do it every single day of the week because I also don't, like I said, it's all about quality, not quantity, right? I want to be able to, every time I do that procedure, I want it to be the best, right? And then I want it to rest, and then I want to do it again. And I want to rest, and I want to do it again. So my schedule is set up exactly like that. So I don't have a full surgical day, and then the next day another full surgical day, and then the next day another full surgical day. By the time I get to Friday, I'm exhausted, right? So I divide my schedule into surgeries, injectables, small procedures, consultations, follow-ups, so that I don't exhaust myself and I'm able to rest.
And just to let you guys know, one of my patients trying to book with Dr. Retana for the surgery, and seems like you're booked till July. Yeah, this is amazing. That just shows what a great surgeon you are, and you do care about your patient.
Well, thanks.
It's not more like a drive-through like McDonald's in and out.
No, not at all. No, not at all. It was all quality versus quantity. I'm sure. I mean, how do you guys do? Do you guys do virtual consults, or is it mainly
I'm not
in
a big
office?
fan in office.
In
Yeah,
office,
I have
yeah.
to see the patient.
Great. Yeah. That's great. I did implement that because our schedule was getting really full with stuff, and I felt like also, I don't know, I have a little like suburban moms that want to see
Yeah.
you. It was they got a little Botox, a little fillers, and then your husband will never know you got something done because you tell, honey, I went to Fuego, got some food, got some takeout. Can you imagine? I get patients. Do you get patients like that? They're like,
The husband.
the husband doesn't know?
Of course not. Absolutely. Yeah. The husband doesn't need to know.
No.
I know. I don't know what it is.
Yeah, no, I get patients like that for injectables, but also for surgery.
Surgeries, yeah, they don't want the husband to
No.
know. I don't know what it is.
Yeah, it's insane.
I don't know what they're. Okay, Dr. Retana, say something very funny about yourself. Tell us a story about the funniest thing you did in operating room and your treatment rooms. I don't know.
Oh, now you're putting me on the spot.
Of course.
Oh, wow.
I have one, but you can go
All right,
for
so
it.
go ahead.
All right, guys. So one of my funniest time ever. I was prepping my patient. I was still working kind of on myself. I didn't have anyone to assist me. The patient is laying down, and I'm like putting the numbing cream. And as I'm grabbing the syringe to start injecting the patient, accidentally I drop the syringe, and it went straight to her breast. So that was my funniest and craziest, and she didn't know whether to scream or cry. So since then, I just really pay attention more to my holding my syringe. I don't even know what happens, but from the syringe stretch right there. So
I'm trying
yes,
to think.
sir, that's the story. So your turn.
I'm trying to think what has happened that could be like,
Anything funny?
Funny. I have some funny stories from my days in the hospital and my office. I mean, we have a great time in the office.
He does a lot of dance.
and
That's a fun.
That is. Oh, you know what? Yeah, let me talk about that. So
Yeah.
one day, what happened was, one of the lymphatic massage places that I work with, Icona Aesthetics, they gave me as a gift like some scrubs that say Dr. Retana, love that body DC. It was for a Christmas thing, and I wanted to sort of say thank you to them. So I put on the scrubs, and I was like, what should I was going to say like a little speech and say thank you, and I was like, that's kind of boring. Like I don't think I'm that boring. Just get in front of a camera and just say something. I'm like, I want to dance a little bit. So I put it, and I've never tried the reels on Instagram. So I'm like, you know what? I'm going to try a little TikTok dance, a little reel thing. And I did that. and obviously like salsa comes up because I'm Latino and I know how to salsa. So salsa comes up. I'm like, you know what? I'm gonna do a little salsa dance. So I start doing a little salsa dance, turn, kick, whatever. And I posted and I said, hey, thank you, Icon Aesthetics, for the scrubs. I really like them. That video almost goes viral, right? It didn't go viral like to that level, but it went viral like in my like it had so many views, so many likes, so many comments.
Love that.
And so next thing I know, my patients, actually one that was logged in here, cookie cutter, she goes, Dr. Retana, I'm getting my BBL by you in like 2-3 weeks. We're definitely dancing before my BBL.
Absolutely. No, that's
and
the thing.
I thought she was kidding, but I was like, by the 10 times, I'm like, I think she's serious.
No.
And I would do it, I'm like, I know myself, why not? So anyway, so she comes to my office, and she changes. I'll do my marking and everything, and she's like, "Oh, so we're gonna dance?" And I'm like, "All right, let's do it." So we did a little dance. We uploaded it on my Instagram. You'll see it if you go to my reels.
Amazing
You'll
dancer.
see those two dances. You'll see the dance I did by myself and the dance I did with my patient before her BBL. And anyway, that was an amazing thing that we did.
Yeah, you're a pro. We have seen those moves. It's incredible. Yeah, unbelievable.
So that was a funny thing and a very unique thing that happened. And if any patient out there wants to dance, y'all let me know before you anything, before you BBL, before you any kind of thing.
Someone asked me if I get nervous about people's expectations since you have such a great comments and posts on social media. I don't get nervous, as of course as I'm doing this for a long period of time. I have learned how to manage my patient expectation. I think it's really a matter of educating your patients and letting them know what result they can get, and really explain the risks that involve with any of this procedure. So of course always there's some anxiety, we're all human, we get nervous sometimes.
Yeah.
Like he was so nervous before we started live. Dr. Retana was crying.
I was sweating, crying.
We fanned him a little bit, we gave him some ice cream, but he's doing great.
I passed out on the floor. No, I don't really get nervous anymore. Public speaking, I really actually enjoy.
He has mastered that.
Someone here says, do you offer non-surgical rhinoplasties at Rejuvenation Clinic?
The answer is yes.
Absolutely.
Well,
let me ask you this: do you do it with fillers and
yes.
PDO threads, or just fillers?
So it depends on the patients. Not everyone's going to be a candidate for non-surgical rhinoplasty. I only focus on the bridge. I don't do much with the tip of the nose.
Lifting?
Exactly. Mm-hmm. I'm not an expert when it comes with the PDO thread lift. So what I use is usually a syringe of Voluma. I may not use the whole syringe. I may just inject a little bit and see how the patient does. What does it look like? And then have the patient come back within 3-4 weeks and do a quick assessment. It is a high risk area. Not a lot of providers love doing that treatment, but I do it. I always follow everything that I can to be safe, but it's one of my favorite treatments. My patient loves it. My ethnicity, my background, I am Iranian. Rhinoplasty is a #1 surgery in my country. So someone like me, I had to have a surgery because the tip of my nose was really large. It was cartilage. It was this thick skin. So again, some patients, they really need to see the surgeon. But
see, along with that, like recently, I had a request by a mom. They called my office and they said, Dr. Retana, do you do non-surgical rhinoplasties? And I do too, with the same technique. I do Voluma for the nose. And she says, it's not for me, it's for my daughter. And her daughter is 13 years old. And the daughter has a big hump right here. It's actually like a model. Like she models for different things. She's like in a modeling agency. But she started growing up and developed the dorsal hump. And she's like, can you do surgery on her? I said, absolutely not. You cannot do surgery on her. Yes, she's still growing. You need to let her grow until at least 17, 18 years old. Then you can do the rhinoplasty. But bring her in and I'll do a quick non-surgical. So yeah, just a little bit of Voluma filler in the nose goes a long way. I can tell you that little girl was almost crying after you do it, right?
It's
and
amazing.
A lot of non-surgicals, they literally look in the mirror like, oh my God. Because it's kind of like,
it's magic.
It's going like for a procedure that is instantaneously gratifying when you look in the mirror.
It's amazing.
Like, wow.
It's such an art.
It is. There's people that do PDO threads with it, but it's a little more high risk to do it, more technique sensitive.
I didn't get trained on that, so. So shall we go over the winners? We have 5 minutes left, guys.
Yeah.
All
Yeah, let's
right.
announce the winners.
Pardon?
Let's do it. Let's announce the
Yeah,
winners.
so we have some numbers. We're gonna choose numbers, and I think we're gonna go first. Can we go with Dr. Retana's patients first?
All right, top 3 would be Cookie Cutter, one of your patients.
All right.
Yay.
So top 3 winners. First one, Cookie Cutter. We're dancing. You got something. You got the what did she get? The Voluma.
So we're gonna draw for that.
We're gonna draw for that. Also, top 3. You're just announcing the winners right now. Cookie Cutter, you got a
Number
prize.
1. Number 2, we're looking at Babes Gang _KB.
Oh, where's that one? Let me see. Say it one more time so I can say announce it.
Babes Gang.
Okay, Babes Gang __ KB. You're our second winner for my side, and then one more. Who's
And
the
then
third?
we have M and number 2 XDY.
MN number 2 XDY. You're a third winner. Amazing.
All right. Amazing! Yay! Give it up!
Yeah, amazing. All right.
Amazing work. Okay,
All
so
right.
now we're going to.
To you. So the first winner is Linda X Webb.
Okay. What do I do? Okay.
Just announce it. So announce it. So
What
I
did-
don't
what was-
think they can hear it.
Oh, they can hear it. Okay, what is the name again?
Linda X Webb.
Linda X Webb.
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 Web.
Web.
Linda X Web is your winner.
All right. Well,
One winner.
congratulations. Did we decide who's getting what? That's my
Not yet.
question.
Not yet.
Okay, we're
Not
going.
yet.
Okay,
We're gonna
so all right, that's number 1. So number 2 will be.
Number 2 will be careful. Fear. Dead. Devotion. So it's a really long one.
This is a really long one. It says careful dot what?
Fear.
Fear.
Careful
Dot.
dot fear dot everything
Dot.
else.
Yeah.
You're the second winner.
You won.
Why are you okay? And then number 3
Number
is
3 is hungry.
hungry.
Underscore eyes.
Hungry underscores
Eyes.
eyes. You're the third one. So yay! Congratulations. So
So for Dr. Retano's 3 winners, they need to pick a number from 1 to 3, and that's how we're gonna give the free giveaway.
Okay.
We numbered them from 1 to 3, so you guys don't know which number.
I gotcha. So guys, what we're gonna do for the winners, the 3 winners, right? Pay attention right now. If you guys won, this is what you gotta do. You gotta text on here. I think you guys heard 1, 2, or 3. What if they both pick the same thing? Because
The
they
first
just
one that goes up. So for Cookie Cutter,
Cookie
she
Cutter
chose
picked
number
2. So Babe Gang and Mindy. Okay.
I have to go again. So Mindy took 3.
Mindy took
and
3,
Babes
so
gets
Babe Gang
1.
gets 1. Okay, so what did they win? Tell me. What did number 1 win?
Cookie Cutter receives free lip filler.
Cookie
woohoo!
Cutter, you got free lip fillers.
That is amazing. Yeah.
Congratulations.
All right.
Number 2. Babes Gang _ KB receives the filler of Voluma.
Babes Gang, you got the Voluma filler. Okay, and DM me and we'll talk all about Voluma. So you got that one.
Last but not least, M2XDY wins Botox.
All right.
All right, Mindy, you got the Botox. All you guys DM me and we'll talk about the details. Okay.
Oh, that is amazing, guys. Yeah, good job. I'm
All
so
right, let's hear about your winners.
All right, let's do it.
Okay. So for Linda Webb, what number did she pick?
They have to go ahead and
They have to
Yeah.
do it.
All right, guys, go ahead, pick your number.
From 1 to 3.
From 1 to 3, you can pick a number.
And we'll
1
see.
or 2 or 3. And what was the name?
Linda.
Linda.
She chose number 1.
Linda picked number 1.
Okay, and then you gotta wait for the other ones.
And then Careful Fear
got
did-
number 2.
She got number 2.
And Hungry Eyes, you're number 3.
By default.
By
three.
default, number 3. So number 1 is.
Okay, so number 1 is Voluma.
Number 1 is your Voluma, syringe of Voluma. So yeah, call the office, DM me. I would love to see you and take care of your beautiful face and get that Voluma, girl.
Nice.
All right, now number
Love
2.
And then number 2, careful, fear, etc. She got Botox, the 20 units of Botox.
All right, congratulations. Yes, we're ready for you whenever you're ready. If you want to come tonight, hey, we're here. 20 minutes of Botox.
Careful
And they're-
fear. She's got the Botox, right?
And then, so number
And then
three,
all 3 eyes got the lip filler.
the lip filler. So guys, just call the office. You can DM me. Would love to have you here, and we truly enjoy this. Thank you, everyone. This was amazing. So now I have a question for you guys. When do you guys like me and Dr. Retana do our next live? It can be for the next couple months because I know he's very busy. He's really busy with surgery. But you guys let me know, when would you like for me to have Dr. Retana back?
And we'll start the live with a
Can
little.
you bring his gift as well? Is that my...
Are you serious? No. And we'll start the live with maybe a little dance or something, right? Next time.
Oh my God.
I did see some of your followers were like, can Dr. Retana do? They said for research purposes, can Dr. Retana dance with us? Absolutely, for research purposes.
So we have
We'll
a
dance.
small gift from Rejuvenation Clinic for Dr. Retana's time. We are so
you
honored.
are too
No,
much,
thank you so
man.
much for
You
joining
gonna
us.
talk to me right now?
Sure, why not?
Let's see, let's take a look.
All right.
I didn't bring it. That is not fair.
You were
should've
my
told me.
guest.
You should have told me.
You are my guest. So this is the one that I promised. This is for your patients. This is the ointment that I use after lip filler.
Oh,
It's
yeah.
amazing. It smells good. It feels good. So
Amazing.
usually after any lip injection, that's what I apply. And this is something that you may like.
Oh, boy. Let's see
We're
what's
honored
going
for you
on
to
here.
joining
Let's see
this
what's going
live.
on. Let's see. Okay.
It's a girl. I'm just kidding.
Oh wow.
Oh wow, it's matching what he's
It's
wearing.
matching what I'm wearing. It's a skinny tie, and it's the same color as my suit.
Well,
And
Dr.
it's a skinny
Retana.
tie. How do you know my style? Thank you guys so much
Thank
for the
you so much.
invitation here.
My pleasure.
I
Thank
really
you.
enjoyed, meeting your staff and everybody that you guys don't see the behind the scenes. There's a lot of people here making this happen,
We're
making
so
sure these
thankful.
giveaways were, done properly, and that everything here is just absolutely over the top and quality work, which is
That's what we do.
this is what
This is how we roll.
this is how we roll.
Dr. Retana's and I, we have one role model in common, and that's Kobe Bryant.
Kobe Bryant, baby.
That's how we roll.
Kobe Bryant, the GOAT. Hard work, right? Hard work pays
Dedication.
off. Dedication.
You gotta be the best.
Yeah.
All right, you guys, have a safe evening. Good
ya.
night.